Welcome back to Girl Talk. If you're just tuning in, we've been having a comfy time here at Monroe Furniture Center.
So great.
We've dug into this couch. I'm not sure we're going to leave, but you're going to leave in just a minute and check out this segment because earlier Janet caught up with Village Smile Care, and if you have kids, this is an important topic. We're talking about pediatric dentistry. So Dr. Angela Cody is going to share some valuable information with us. Let's take a look.
Well, if you have little ones at home, you may be starting to think about when it's time for them to be brushing their teeth, or maybe even when they first have their first dental visit. Here to talk to us about dental care for our kids is Dr. Angela Cody from Village Smile Care in Mount Horeb. Thanks for letting me come back and talk to you about dental care.
You're welcome. Thanks for coming.
So, what age should we start thinking about dental care for our kids?
Actually, it starts before they're even born.
Oh.
Yeah, there's a lot of hormones during pregnancy that can affect the baby. And so women tend to sometimes get more gum inflammation called gingivitis, bleeding, and red gums. And that can actually lead to premature birth and low birth weight babies. So it's really important to watch your oral health yourself during pregnancy. Also, the bacteria that cause cavities are passed down from mother to child. So if the mother has a healthier mouth, that will be passed along to the child as well. And the enamel is forming before the baby's even formed. So prenatal vitamins and proper diet are important.
That's all news to me. That's really interesting.
Yeah.
Not at all what I was expecting for your answer.
Yeah.
So then when we finally do have this child
Yes.
and we're ready, when is the first time they should come in to see you?
The American Dental Association actually recommends about 6 months after the first tooth erupts, which is around age 1, which seems really early to most people, but there's a lot of tips and tricks the dentist can give and education to the parents about caring for the teeth and diet and things to look out for.
I suppose, and if you can set those patterns early on, it just makes things so much easier down the road for probably everyone involved.
Definitely.
I think people might wonder though, do baby teeth even really matter? Because they're going to fall out anyway. What do you say to that?
Yeah, they're actually more important than you'd think. They hold the space for the adult teeth, so if a tooth is lost early due to a cavity or trauma, the jaw can kind of collapse a little and there's not space for the adult teeth. So it is really important to keep those teeth until they come out naturally. Also, the nerves inside the baby teeth are large and the teeth are small, so even a small cavity can grow rapidly, causing an infection or a toothache, which can cause the child to not be able to pay attention in school, lose sleep, not eat properly. So they are very important for development.
Yeah, a domino effect for sure.
Yes.
And maybe even develop the dislike of going to the dentist.
For sure.
What can be done then? What should we be doing to prevent cavities for our kids?
Obviously, most people are aware of proper hygiene, like you do for yourself, brushing twice a day, flossing. Also, there's been advancements with fluoride and sealants, which have really decreased dental decay. So fluoride is in the water naturally, but if you live in the country or drink bottled water, just checking your fluoride content and maybe getting a fluoride supplement that helps the strength of the enamel, as well as applying professional fluoride at dental visits. Sealants are something the dentist can do in the back teeth if there's deep pits and grooves, which is common, more so in the adult teeth, but that seals off and prevents those areas from decay because those are little areas that the toothbrush can't reach and microscopic decay can get into.
And are those treatments also for baby teeth? And when do kids lose their baby teeth then?
Yeah, most kids start to lose their baby teeth around age 6. It can vary through age 12. And sealants, depending on the risk of the patient, can be for baby teeth or adult teeth.
Oh, okay, good. And what about a little bit down the road when we're talking about orthodontic care and having teeth straight? Is there more to it than just cosmetic?
Yeah, the health of the teeth, if they're not straight, they can be more difficult to clean, so that can cause gum disease as well as increased cavities. And also at a younger age, around age 7 is actually when you first want to start looking at if the teeth are crowded or not. If they are crowded at that age, it can actually affect the growth and development, and the jaw won't grow properly, which can cause joint issues down the road. So taking an early look is important. Some treatments are beneficial during the growth period. And basically, if we can get that treatment early, we can help them grow better and avoid future extractions and things like that. So there is definitely a health component to the crowding of the teeth, and it's good to check that out early.
Boy, an ounce of prevention in so many different ways.
Yes.
Great. Well, thank you. That's been really interesting. Preventive care for your children and dental health. That's a wonderful topic. This is Dr. Angela Cody. She's at Village Smile Care in Mount Horeb, and we're Girl Talk. We'll be right back.